What if symptoms that have been dismissed for years aren't all in your head, but signs of an underlying tick-borne illness or complex chronic condition that needs a different kind of care? Today, we're talking with Ginger Salvely, DNP, one of the leading voices in Lyme disease, Morgellons, and tick-borne illness care. She brings decades of clinical experience and a deeply patient-centered approach to some of the most misunderstood conditions in medicine. Welcome back to Let's Talk Wellness Now, the show where we uncover the root causes of chronic illness, explore cutting edge approaches to healing, and empower you with the tools to take charge of your life. I'm Dr. Deb, and today we're diving into the complex world of Lyme disease, co-infections, Morgellons, and the deeper factors that can keep people stuck in chronic illness. If you or someone you love has been struggling with unexplained symptoms, fatigue, brain fog, pain, or a long road to answers, this episode is for you. So as usual, grab your cup of coffee, tea, or whatever helps you settle in, and let's get started on today's journey toward deeper healing. Ladies, it's time to reignite your vitality. Primal Queen supplements are clean, powerful formulas made for women like you who want balance, strength, and energy that lasts. Get 25% off at primalqueen.com/Serenity Health. That's primalqueen.com/Serenity Health, because every queen deserves to feel in her prime. Well, welcome back to Let's Talk Wellness Now. I have dear lady, Dr. Ginger. She's being so gracious because we already goofed up our first recording we did on Riverside a few months ago. And she's been gracious enough to come back and join us again and do it all over again while we're actually recording. So, Dr. Savely, welcome to the show.
Thank you. Thank you so much for having me. I appreciate it.
So, Dr. Ginger, tell us a little bit about how you got involved with tick-borne disease and Morgellons, because you are truly a legend in this world, and I'd love for everybody to hear your story.
Well, I just to very briefly go over, I got into the tick-borne diseases because my daughter was so very sick with it, and I started learning everything I could. And then next thing I knew, I was picking it up in my population. I was doing primary care, family practice, and I was picking it up in that group. And then word got around, and next thing I knew, I'm treating a lot of tick-borne disease. Became 50% of my practice, then 70% of my practice. And then a few years into it, I started having, well, first of all, Dr. Harvey, who was a Lyme doctor in Houston, Texas, he and I were constantly communicating about things and comparing notes. And he emailed me and said, "Have you seen any patients with, blue fibers coming out of them?" And I said, "I don't think so, but I'll start looking for it." So then I did. And I started asking all my Lyme patients about it. Just, have you had any unusual things come out of your skin? And once I asked them, then lo and behold, a certain subset of them said, "Well, yes, as a matter of fact, I do have that, but I've just learned not to mention it because people think I'm crazy. So I just never, say a word about it." And so I started picking up a lot of these patients. And, of course, since I first came at this by way of tick-borne diseases, Lyme, etc., I figured, okay, these people I know have tick-borne disease, so let's treat that and see if maybe their immune system recovers to the point where they can handle whatever this is causing the Morgellons disease. And so that's the way I approached it at first, just treating underlying infections, since I had no idea what was causing Morgellons. I just noted an association with Lyme disease. And so I put out a paper about 20 years ago. I published a paper that had to do with basically one thing. The main point of the paper was correlating Lyme disease with Morgellons, saying that 97% of my Morgellons patients ended up having Lyme or another tick-borne infection. And so this is the first publication that basically kind of made that correlation, between the Lyme. And I think it's been taken out of context a lot, misinterpreted. I never for a minute said that Lyme causes Morgellons, not at all. And that's a leap way too far for us at this point. I just noticed an association. So whatever that may mean, who knows? But, certain illnesses, like, for example, AIDS patients are famous for getting this Kaposi sarcoma.
Mhm.
And it doesn't mean AIDS causes that sarcoma because other people get it too. It's just highly associated with the two. So we might be talking about a disease that's highly associated with tick-borne infections, or maybe it's caused by a co-infection that we don't even know about. Or maybe it's something entirely different. And the tick-borne diseases were just suppressing the immune system to the point where the person succumbed to whatever this was whenever they got into contact with it. And
Yeah.
so I began, just experimenting and trying different cocktails of things to see what would work. And as I began to treat, I realized that the Morgellons patients did not get better with the Lyme protocol. They got better when I used a Bartonella protocol, a specific group of antibiotics that's used to treat the Bartonella infection. Now, again, I'm not saying for a minute Bartonella causes Morgellons, but I'm
Right.
just saying that when I use the treatment for Bartonella, that's when I get the best results on my Morgellons patients. And I also have noticed that my Morgellons patients tend to have other symptoms that are typical Bartonella symptoms, like a lot of the neuropsychiatric, sorry, and the streaks that they'll get on them, the red tracks, spontaneous scratches, all that. So those we do see on our Bartonella patients that don't have Morgellons.
Yeah.
So I started. It was my early patients where I would always say you're the lab rats because we're just experimenting with everything, and they were more than willing. I mean, these people were
Mhm.
so desperate. They were so miserable and so upset by the way they'd been treated by the medical establishment that they were, every one of them, at a point of saying, I don't care what you give me. Even if it kills me, I'd rather be dead than have to deal with this. So
Yeah, the right to try something, right?
that's pretty drastic, I know, but that's where they were. They were at a point where I don't care, I'll take any risk just to do this. However, I've always been using FDA approved medications, and it's just naturally I'm treating in my own kind of invented way because there's no textbooks you can go to for this. There's no algorithms, there's no treatment protocols for this because more than half of the medical world doesn't even believe it exists.
Yeah.
So I looked very carefully at all these patients in my office with the lighted magnification, and I was seeing amazing things. I mean, I couldn't believe it. Sometimes the hair on the back of my neck would stand out when I would see these things because, bright blue fibers are not supposed to be coming out of a human body. And I would even pull at them with the tweezers and, they would not come out. So it wasn't like a matter of they were just stuck on there, it's from fabrics or something as dermatologists often claim is the case.
I had a patient once with Morgellons, and she got a magnification glass that she could attach
Yeah,
to her phone.
yeah,
And she like took pictures of what was coming out of her skin and video recorded it and sent it
yeah.
to me. And oh my gosh, it's crazy how these things come
It is
out. And if
great.
you don't see it under a microscope like that, it's really hard to understand what's going on for these
Exactly,
people.
exactly. And what we've always said is dermatologists usually carry about a 12x scope in their
Mhm.
pocket,
Yeah.
but you need really more like 60x
Mhm.
to see this stuff because very rarely can you see it with the naked eye. I mean,
Yeah.
sometimes you can, but you do need that lighted magnification
Mhm.
in order to see it. I do have some patients come to me, they have all the symptoms of Morgellons, but they say, I don't think I have fibers. And I said, well, but have you really looked with
Mhm.
magnification? They said, well, no, I just thought I'd see them. So then it turns out they actually do have them. But
Yeah.
so I've been fascinated mostly then in treating these patients by how diverse each patient is, because I can develop a protocol that's working fantastically on this patient and try it on the next patient. It doesn't work at all.
Mhm.
So it's just back to the drawing board, every single
Yeah.
patient.
Mhm.
And of course, there's a huge variance in degree of severity of this illness. I have everyone everywhere from people who are totally functional, go into work and just have this annoying thing going on, all the way to people who are just completely marred and disfigured and can't even get out of bed. So, of course, there's quite a difference there. Naturally, it's a lot more difficult to treat the more severe cases. And often with the more severe cases, our best hope is reducing symptoms significantly to where they're tolerable. But
Yeah.
in the very severe cases, I don't think I've ever had a person yet get 100% well. But I do have plenty of others that have gotten 100% well, but maybe they wouldn't fall into the most serious category. But I've tried everything. I've tried antifungal protocols, antiviral, anti-helminthic, and just I've tried it all. I swear, I don't think there's anything I haven't tried. And sometimes you hit on what works for that patient. It might be a surprise. I
Hmm.
had one patient, I'd been trying the antibiotics with her. We weren't getting anywhere. And then I just started treating her with itraconazole, an antifungal, and she just got so much better. And I think probably because in that case, one of her main immune challenges was she was probably exposed to mold. She had probably had colonization in her sinuses
Hmm.
or wherever else in her body of the mold. So that I think if you can find the main thing that's really dragging the immune system down and work on that thing, then hopefully you'll lighten the load on the immune system to where this Morgellons can take care of itself. Because we do know a lot of people get it and barely get sick at all. A lot of times people will tell me their spouse or their child or somebody says, "Oh, they've had like two tiny lesions and they've had a couple of fibers and basically that's it." So
Hmm.
I by that I'm assuming that this is something that usually only those who are very immune challenged actually come down with. And that's what I found through the years that they are immune challenged. I've had AIDS patients with this. I've had people on high dose corticosteroids because they had an some kind of autoimmune problem. I've had several organ transplant patients because they're given strong immunosuppressants so
Yeah.
they won't reject the organ. So it's not 100% Lyme patients. And that's the thing where I disagree with some of the researchers who are trying to propose the idea that Morgellons is a dermatologic manifestation of Lyme. No, I mean, I know how to diagnose Lyme disease. It's a
Hmm.
clinical diagnosis. I have
Hmm.
patients that not only are just zero, zero, nothing on hygienics, they have not one single symptom of tick-borne disease. When you give them antibiotics, they don't hurt, they don't get better. There is no indication that they have Lyme or co-infection, but they have all the awful skin stuff. And in fact, I have found through the years that those people are kind of my hardest ones to treat because I
Yeah.
don't know what to work with. I don't want to give them all these antibiotics for tick-borne disease if they don't
Mhm.
really have that.
Right.
Yeah.
It's hard to find that initial trigger, right? That's what we're always looking for is
Yes,
that initial trigger. And
exactly.
if we can't find the initial trigger, how do you know where to start? It's like a guessing game.
I know. So, and of course, the other thing I've discovered through the years is that another immune challenge that is common to all these patients is mold toxicity.
Yeah.
So if I don't can't find any particular infection to treat,
Hmm.
then I start thinking about the possibility of that the patient is mold toxic, that they are living in now or previously lived in a moldy home, or maybe sometimes they work in a moldy place.
Hmm.
And for, 1/4 of the population, these mycotoxins are just huge immune suppressants. And so I used to test that genetic haplotype test that Dr.
Yeah,
Shoemaker does.
me
I used to
too.
do it on all my Morgellons patients. Every single one of them came out mold susceptible. So after a
Mhm.
while, I just stopped doing it because
Yeah.
I kind of got the point. And also, it's an expensive test and insurance
Mhm.
often doesn't cover it. So, but anyway, that is, excuse me, I got to take a drink here. My mouth is
Okay.
dry. Okay, so All right. Now, of course, I have to figure out where I was. What were you
We were
saying?
talking about mold and Schumacher
Oh,
testing,
yeah.
how everybody's
So,
positive for that.
yeah. So, you know, mold is the big thing now, right? I mean, I know we're all
Yeah.
looking at it. I've
Mhm.
been in the Lyme world long enough to remember back when we didn't, and we were always so baffled why
Yeah.
some of our patients just didn't
Mhm.
get better. Why aren't they getting better? I'm doing the same thing with them.
Yeah.
They're not getting better. And then come to find out is, they had these mycotoxins that their body was not able to detox. These people can't detox the
Mhm.
mycotoxins on their own. So they're quite an immune suppressant if you've got those going on. So there's other things that hold people back from getting well, of course. I find that my PTSD patients can't get well unless they're really actively working on the PTSD by going to therapy groups, whatever, it is.
Mhm.
I find that people who live in a smoky home where people smoke, well, I don't even take patients who smoke because that's just so counterproductive to getting
Mhm.
well. But sometimes you could live in a home where everybody's smoking, and that
Yeah.
passive smoke too is so bad too. So, and then of course I've got people, unfortunately, that may be living in abusive situations and can't get out, and that is also another thing that just halts the treatment.
Yeah.
So, everybody, a lot of times people will get online and say, you can never get well from this. Don't even believe anybody that says you can get well.
Yeah.
Well, that might be the case in your case because we don't
Mhm.
know all the various immune challenges you have, but every single patient is different. And that's why I really can't publish a protocol or anything like that because
Mhm.
it's kind of more of an art than a science almost. You
Yeah.
just have to feel your way through it. But through the years, I have kind of I found that there's two antibiotics. If I start with those two, I'm pretty much always going to get some kind of a good response.
Mhm.
And that is a sulfa drug and clarithromycin, the two of them together. Now, that's not all I do, but that's a starting point. And I often
Mhm.
tell other doctors, look, if you're going to refer them to me, get them started on those two drugs. Just that'll already help some. And what,
Sure.
yeah. And now, of course, a lot of people are allergic to sulfa, so then
Mhm.
we have to go with something else. But there's a lot of different combinations. But basically, I've found that like if I really go after that Bartonella and I do a combination like the sulfa, doxycycline, and rifabutin, for
Mhm.
example, those really get us somewhere. But it's
Yeah.
not never a quick fix. It takes a lot of patience because it's slow to get over this.
Mhm.
But yeah,
Yeah, it seems like, a lot of what we're talking about in the tick-borne world these days too is immune system, right? And there's so many
yeah,
new things that we're learning. I was having a conversation with one of the docs from Invita Medical, and they were saying they are seeing a lot of their Bartonella patients are developing cancer. And so all of these things that suppress our immune system, and there's so many in the world, right? Do you think that's partially why so many people get overlooked and misdiagnosed when it comes to a tick-borne illness or a Morgellons illness because they're not looking at the root, they're not looking at the immune system, they're just kind of looking at symptoms. And of course, everybody thinks these people are crazy because they have so many bizarre
right,
symptoms,
right. Well, I always tell my patients, like if they have to fill out a form or something
Hmm.
saying what they have, I always say you have Bartonellosis because Lyme is a trigger word.
Yep.
Morgellons doesn't exist.
Yes.
So just put you, and when they take that to another doctor, 9 times out of 10, the other doctor doesn't even know what that is.
They don't.
They know what cat scratch disease is. They know
Yeah.
that name, and that's an
Hmm.
acute Bartonellosis. But if you say Bartonella to them, they're kind of confused.
Yeah.
And so, in a certain sense, that's kind of a good thing because it's
Hmm.
better than it being a knee-jerk reaction like, get out of here,
Yeah.
you're crazy.
Crazy. Lyme doesn't exist. What are you talking about?
Right, right.
Right.
It's a trigger word too, but they're kind of
Yeah.
baffled with the Bartonella, like, oh, wait a minute,
Mhm.
what is this? And
Yeah.
so that's always I think a good approach to do. But yeah, I'm always pointing out to my patients that it's a lot easier to catch Bartonella than Lyme because there's so many. There are more different vectors for Bartonella than any other vector-borne infection.
Mhm.
So there's a number of different bites you can get where you could get Bartonella. And I notice a lot of my patients start having Morgellons after a flea infestation. And
Yeah.
fleas can give you Bartonella, of course.
Yeah.
Cat scratches can too. A lot of
Yeah.
little biting
No-see-ums.
insect.
Hmm.
And in fact, who knows? We don't even really know all
Yeah.
of the ones that could possibly give Bartonella.
Mhm.
So Bartonella needs to be really high up on the list of the differential, and it's not on the list at all with most.
Mhm.
I don't even think infectious disease doctors, but certainly not primary care doctors.
Right.
So I don't know what the connection is with Bartonella. It may
Hmm.
just simply be coincidentally the same things that treat Bartonella treat this. Who knows? The thing is to say anything like so and so causes Morgellons. We're not even close to being there, in terms of the little research we have.
Hmm.
Sure, we have research that shows the presence of certain pathogens in the lesions, but correlation does not equal causation. So we don't know what that means that they're there.
Hmm.
But interestingly, there are about I think I put this in my book even that there are about 15 different kinds of skin lesions where if the patient has Lyme,
Hmm.
you can biopsy the lesion and you'll find Borrelia, the spirochetes, the causative agent of Lyme, in the lesions. So, did the Lyme cause those? Nobody knows because the Lyme bacteria loves to go to the weakest part of the body.
Yeah.
And so it's going to go to any like a lesion that it's going to go there because it's
Hmm.
a weak part of the body. So it may be there just for that reason. It doesn't necessarily mean it's causing it. So lots and lots of work to do in terms of research on this, but it's very difficult because, money, we don't have
Yes.
money for it. And,
Yeah. There's
we,
no money behind it if we don't have a drug to fix it, right?
yeah, that's true. And I mean, we just can't really get anybody interested in it, like CDC or they just are, they did such a, they just didn't really put their heart into doing that one little research study they did. They
Yeah.
used all the wrong patients. They didn't even have an inclusion criteria for the patients. And so they actually admitted patients to the study that, yeah, they didn't have Morgellons. They basically admitted everybody who'd been in saying with something itchy. Of course, a lot of those people didn't have it.
Yeah.
So it was so crazy.
Yeah.
But yeah, I feel very constantly very frustrated that nobody's really looking into this because it
Mhm.
is amazing what it can do. I have
Mhm.
patients with big holes in their faces. I have a patient who developed cervical cancer while I was
Mhm.
treating her. She had the treatment for it. And it all started out though when the doctor saw a huge lesion on her cervix. And when
Wow.
trying to get a little scraping, like to do a biopsy,
Mhm.
it just a hole opened up, just a
Oh my
hole.
gosh.
And this is what happens to a lot of my patients. It's like they develop kind of craters in their face, just
Mhm.
deep, deep holes. So
Mhm.
there are so many aspects to this disease. I mean, it's way more than just the fibers, the filaments.
Right. Exactly.
There's so many other odd things that's going on. They all have this sort of a sticky thing all over their skin.
Mhm.
Biofilm, I don't know, but
Yeah.
they all complain about that. They
Mhm.
have like a black tarry stuff coming out of their skin.
Mhm.
All the different things that come out too, they look like some of them do look like little tiny white maggots. And so you can
Yeah.
kind of see why people do think that they
Mhm.
have some kind of a infestation because an infestation means when you have something along the lines of a, flea, lice,
Yeah.
that sort of thing. But many, many patients come to me convinced that that's what they have. I don't know. Maybe some of my patients do have that
Hmm.
as well, but some of the symptoms are very unique to
Hmm.
Morgellons, and primarily one. The one symptom that is totally unique to Morgellons is these filaments of different colors that come out. And you can compare Morgellons to, in fact, I did in my book, to any number of dermatologic manifestations. And
Hmm.
you can find them that are almost exactly like it, but always the one difference being that Morgellons has the fibers and that other diagnosis does not. So many of my patients have been misdiagnosed with one of those other things because
Hmm.
I think the dermatologist or whoever gave the diagnosis wasn't really looking carefully and didn't really
Hmm.
believe the patient when they said
Yeah.
they had filaments. They usually think, oh, they're just from your clothes. They're just stuck to
Right.
you,
They just don't know. They
Yeah,
don't know,
yeah.
unfortunately.
But they
How do
don't
we,
have the curiosity either. Just
right.
mind
If
blowing.
I know, right? If
Yeah.
it's just kind of straightforward, black and white, that's all they
Hmm.
do. So, Dr. Ginger, how do we help patients feel believed again after being dismissed so long and by so many doctors that
Yeah.
just don't know what they don't know, but they're trying to be helpful. And unfortunately, sometimes they're not. They're hurting the patient by telling them that this is all in their head, or
Yes.
it's just,
And I mean, of course, we just need much more education of the doctors, right?
yes.
Because
Mhm.
they're
Yeah.
the ones that really need, but there are some things that patients do need to be very careful about. And this is just all in the world of learning how to tiptoe around doctors. One thing, never say the M word. If you go
Yeah.
in, never say, don't even suggest it. Just go in
Hmm.
there like kind of dumb, like, oh, I got this thing going on. What do you think it is?
Hmm.
You don't want to do that. You don't ever want to suggest a diagnosis either. Just act stupid because that way they'll really look into it. But if
Yeah.
you suggest a diagnosis, then they get irritated and they just don't want to even look into it any further. So
Hmm.
you do just sort of have to play dumb a little bit and just go, gosh, what could this be? I can,
Hmm.
and tell the symptoms. Now, even my patients have done that though. A lot of times they feel maybe the doctor doesn't say they're crazy, but they just feel like they're kind of brushed aside, like, yeah, well, okay, just put some cortisone cream on it or,
Hmm.
that kind of thing. And
Hmm.
I think that just sort of speaks to what's happened in our medical system lately. I'm very disturbed to hear the stories of people saying the doctor spent very little time with them, seemed rushed, didn't even look at them, didn't even touch them, certainly
Hmm.
didn't look a magnifier.
Yeah.
And I'm very distressed by the state of healthcare in our country,
Hmm.
how this is happening to people. People feel very, very disillusioned with healthcare nowadays. They don't
Yeah.
trust doctors anymore because,
Mm.
they've led them
Right.
astray so many
Right.
times. And so, yeah, I don't know what we're going to do about that predicament.
I know my mother-in-law is 86 and she told me when she went for her physical last year, they never took her clothes off. They didn't even listen to her heart or lungs or feel her liver, nothing. I said, well, that's not a physical exam.
But you
And
know what that is? It's a Medicare wellness check.
that's what,
And you
yeah,
have to
she's,
get a Medicare well, but all this is the
yeah.
Medicare wellness check. They ask you like five questions. Have you
Mhm.
fallen? Da da da. They ask you the
Yeah.
questions. I think they weigh you and,
Hmm.
review
Maybe
your
take your blood
meds and
pressure.
that's it.
Mhm.
So no, it's not a real physical. It's just something to make Medicare happy.
Yeah.
But yeah, I know the people start being overlooked as they get older. They just
Mhm.
kind of, well, you're old, whatever,
Yeah.
so they don't worry so much. And I've had patients as old as, I guess my oldest patient with this was 88. And
Hmm.
those older people are so miserable too when they have this. And
Yeah.
they really are just not so much told they're crazy, but just kind of, whatever.
Yeah. You're
Next,
old. Yeah.
Yeah,
You're,
doctors are just not particularly interested in what's going on with them.
You're old. What more do you expect? I hear that a lot from my older clients that that's what they're
Exactly.
told.
I
Yeah.
remember when my father lived to be 94, and the thing that frustrated, and he was a PhD in physiology,
Mhm.
so he had actually worked with MDs a lot, and
Yeah.
he used to get so angry about that whole situation. He would often say, I go to the doctor, I complain about a pain, and they laugh and say, "What do you expect? You're 90."
Mhm.
And my dad was always very active to the end,
Yeah.
and he didn't, it was unusual for him to have the
Mhm.
pain, and it should have been looked into rather than just
Yeah.
scoffed at like that.
Yeah.
But
Just
that is
dismissed.
it is a problem, in our system, and you don't find too many specialists in advanced care, in geriatric, whatever you want to call it.
Yeah.
I'm fast approaching that age myself, so I hate to use the word geriatric. I think I'm technically geriatric right now, but I can't.
We'll just bypass. That's just a number,
Yeah,
right?
yeah, yeah. But yeah,
Dr.
so
Ginger, this is a great conversation. I always like to end our show with one last question. And this is
yeah.
always a doozy. So you'll have to put your thinking cap or you'll have to calm yourself when I ask this one. If there was one thing you could change in our medical system today, what would it be?
Well, it would all have to do with insurance because
Yeah.
insurance is the thing that's making doctors feel so rushed that they can't
Mhm.
really take time and listen to the patient and properly examine them. Because in order to make enough money, with what insurance reimburses them, they just have to,
Yeah,
move them
keep
in, move
going.
them out. And so, if doctors were given, and I bet some of them would really enjoy being able to spend more time with the patient and really listen, but
Mhm.
they just can't because of the way it's all rigged up with the health
Yeah.
insurance. And so I want to think that doctors would be happy to do that if they were able to. But
Mhm.
that's the thing is I remember writing a paper even when I was in my undergraduate about the importance of validation. And this is way before I knew anything about Morgellons,
Mhm.
but it was just like a big deal to me. Like, people need to be listened to and heard
Mhm.
and not brushed off. And validation, uh, when people are validated, they already feel 50% better. It's
Yes.
just, people will say that after the first visit with me, and I haven't even done anything yet, that they
Mhm.
already feel better because somebody's finally taking them seriously and
Yeah,
listening to them and really caring. And I mean, shouldn't that be basic to all healthcare?
it
I,
should be.
I
Mhm.
would think it should be, but it's just not always the case these days, I see.
Yeah, I agree. I agree.
Yeah.
Well, for people who are listening to us and they're like, I want to talk with her, I want to meet her, how do they find you?
Well, the email address is Lyme DC, Lyme, Lyme, DC is in District of Columbia. That's where my office is, lymedc@gmail.com. And that is the address to ask for a new patient packet. I am still accepting new patients. Usually takes a couple of months to get in, but I have people fill out paperwork first. Um, Sometimes, I mean, I accept most patients, but there's occasionally when I look at the history, if they've already been to 15 other Lyme doctors, I might not. But, I just like to know in advance as much
Mhm.
as I can
Yeah.
about the patient because it's very hard to, I can't really give advice to Morgellons people who just talk to me briefly because, oh my gosh, I need to know so much. I need to know
Yes.
so much about their history and their, I
Mhm.
mean, it's just, and I think people get frustrated with me because, come on, just give me some tips here real quick. And it's like it's so dependent on your story. It's so
Yeah.
individualized that I don't feel even good about trying to give advice to somebody just randomly out of the blue like that. And I guess maybe it makes people frustrated and makes them think, oh, you just want the money or something. No, I mean, it's a lot of responsibility for me
Yeah.
what I do. I've been taking care of Morgellons patients for 25 years. It's put me at very high risk. I've been
Mhm.
investigated before by my board, and I'll tell you, it was not a very
Not fun.
pleasant thing to go through.
Yeah.
And so I said, you have to keep a little bit of a low profile,
Yep.
and so people just need to understand that if somebody is taking care of their Morgellons, that the healthcare provider who's taking care of them, they're taking a personal risk
Hmm.
because they're doing something that's not accepted by
Yeah.
the general medical population and by their regulatory board. And so they could very well be called out and even lose their license for doing it.
Yeah, very much so. It's good to point that out because these
Yeah,
doctors, we're all putting our neck on the line to help these
exactly.
patients. And sometimes the patients don't appreciate that or don't understand that.
I
And they
I
can
think
put
so.
us in harm's way sometimes without
Without
realizing it, and
realizing it.
sometimes
But
on purpose. But
most of my patients, though, are just, they're so protective of me.
yes.
They go to the ER for something and then they'll say, oh, who's treating your whatever
Hmm.
the so-called Morgellons? And they'll say,
Yeah.
well, don't worry about it. I have a good provider.
Yeah.
They
Mhm.
just won't even give my name.
Yeah.
But I get you, like you say, sometimes accidentally it has happened that,
Hmm.
and then I get a call from some ER doctor, and it's usually ER,
Hmm.
emergency room doctor,
Yeah.
yelling and screaming at me, and
Yeah.
it's just like, oh yeah.
Yeah.
So
It's unfortunate, isn't it? I had a patient recently see another GI doctor who said, if I prescribed three different antibiotics at one time, I'd lose my license. And I'm like, oh, well, not really. And it upset the patient quite a bit because now they look at me and they think I'm doing something wrong because the conventional person told them that it was a problem. And it's really sad how those things happen.
well, this is something that's really gotten me very annoyed lately is when pharmacists see things prescribed that they're worried about, their
Hmm.
job is to contact the doctor and say,
Yeah.
hey, are you really sure about this? Because this looks,
Hmm.
no, what they're doing is scaring the patients to death.
Right.
They're
Hmm.
saying, okay, here's what your doctor gave you, but I'm just going to warn you. I mean, geez, taking all those at once, gee, I wouldn't, and that's the
Yeah,
way they're
exactly.
talking. So then they lose faith in me, and they don't realize I've been doing this so long and I've had so many thousands of people take this. I know from experience this is
Hmm.
not going to hurt them. But
Right.
the pharmacist just read it in a book somewhere, so they assume that it's going to be awful for people.
Yeah.
But that's very unprofessional of them to do that. That's not
Yeah.
really their job to do that, but I
No,
it's happening a lot. I see
it's
that.
happening a lot. Instead of just picking up the phone and calling the doctor, they're like you said, upsetting the patient or calling the board or those kinds of things. And what happened
Yeah,
to that
right,
professional courtesy and that exchange of our knowledge bases?
right.
I've gone to the pharmacy and picked something up, and the pharmacist looks at me. He says, "I don't know what this drug is," and it happened during the pandemic when I was prescribed hydroxychloroquine, and I'm like, you don't know what hydroxychloroquine
He's a
is?" I
pharmacist.
was like, really? And it was an older pharmacist. And I was like, really? And I was like, at first I thought, are you just saying that because you don't understand why you're giving it to somebody? Or are you saying that to hope that I say something different? But it
Yeah.
was really surprising to me how many
Is this a trick
medications.
question?
Yeah, yeah. How many medications the pharmacists really claim they don't know anything about or they don't know how to use it. That's their
That's
job to know
very
that.
scary.
It's very
Yeah.
scary these
I'm
days.
seeing a lot more incompetence in pharmacists. So many
Yeah.
scary mistakes being made all the
Yeah.
time now. All
Hmm.
started with the pandemic. It
Yep.
was ever since the pandemic,
Hmm.
pharmacies are making tons of mistakes.
Yeah.
Remember getting so mad at one time. I said, "Look, you have one of the two careers where you're never ever allowed to make a mistake: air traffic controllers and you."
That's
And I said,
right.
"Unfortunately, I'm sorry for you, but you cannot make a mistake."
Yeah, they
And,
can't. I mean, it
and
can
they
be
do.
deadly for them, and they do.
Yeah.
And unfortunately, I think, it's who they're hiring. It's the corporate aspect of the pharmacy these days.
Yeah, probably so.
Yeah, it's a big mess.
Well, I didn't mean this little part here to
Oh,
scare people.
yeah.
I'm sorry about that. I didn't intend to do that, but I just feel like one thing I do, is if you go pick up a prescription, don't walk away from the counter yet.
Yeah.
Look at it. Look at the bottle. Make sure
Hmm.
that's what you're supposed to get, that the quantity's right, that everything's good. Because
Mm-hmm.
once you walk away from you don't have any recourse. So
Right.
before you even leave, just check it out and make
Mhm.
sure.
That's
And a
right.
lot of times people are given the wrong quantity or any number of
Hmm.
mistakes. So
Yeah, they don't tell you that your insurance won't dispense the full amount, or
right, they
they're,
just they
they
just
don't
give
have
you
it all on stock, so they're only giving you a partial fill. They won't tell you any of those things. And then you have to
right.
try to call and get that information from them after the fact, and it's not fun to try to do that for sure.
Oh my gosh, no. I hate calling pharmacies.
I know, me too.
Oh,
Oh, well,
yeah.
Dr. Ginger, this was such a great conversation. Is there anything else you want to leave our listeners with before you and I sign off?
I just want them to have hope. That's the most important thing. Because many patients with Morgellons do give up hope, and there's a high suicide rate in this group. And don't give up hope. Don't give up. There are people out there who can help you. I'm not the only one. There aren't many of us, but
Yeah.
there are some other I would be able to refer you to if I can't take you on. And just know that there are those of us out there who believe in this. We know it's real, and we're just desperately trying to see what we can do to help.
Well, thank you for all your years of support and patient-centered approach.
Sure.
It's definitely a blessing to have you. Thank you.
All right. Thank you so much for having me.
Thank you so much for joining me today on Let's Talk Wellness Now. Dr. Savely's decades of experience working with Lyme disease, co-infection, and Morgellons, and your compassionate, patient-centered approach are such an important reminder that healing starts with being heard, believed, and truly understood. If this conversation resonates with you, I encourage you to share it with someone who may be searching for answers and hope on their healing journey. Remember, complex chronic illness is not something you have to navigate alone. For more information about Dr. Savely's work, visit her on her website, and we'll put those links below. And until next time, I'm Dr. Deb, reminding you to take care of your body, mind, and spirit. Be well, and we'll see you on the next episode.
Welcome to Let's Talk Wellness Now, where we bring expert insights to you. Please note that the views and information shared by our guests are their own and do not necessarily reflect those of Let's Talk Wellness Now, its management, or our partners. Each affiliate, sponsor, and partner is an independent entity with its own perspectives. Today's content is provided for informational and educational purposes only and should not be considered specific advice, whether financial, medical, or legal. While we strive to present accurate and useful information, we cannot guarantee its completeness or relevance to your unique circumstances. We encourage you to consult a qualified professional to address your individual needs. Your use of information from this broadcast is entirely at your own risk. By continuing to listen, you agree to indemnify and hold Let's Talk Wellness Now and its associates harmless from any claims or damages arising from the use of this content. We may update this disclaimer at any time, and changes will take effect immediately upon posting or broadcast. Thank you for tuning in. We hope you find this episode both insightful and thought-provoking. Listener discretion is advised.